All right, hi there. My name's Tim Smith, and I'm a third year medicine here at OSU. And we'll get right into the poster. So today I'll be presenting a poster regarding the evaluating artificial intelligence guidelines for authorship in leading hematology journals or cross-sectional study. So to begin, the emergence of generative artificial intelligence, known as AI, such as ChatGPT and Bard, have impacted academic writing and research by improving data analysis, enhancing systematic reviews, and optimizing clinical decision making. However, their increasing use raises ethical concerns related to authorship, copyright, and the risk of plagiarism, noting the need for transparency to uphold academic integrity. Leading organizations, including the ICMJE, emphasize the importance of disclosing AI involvement in research. So this study investigates whether prominent hematology journals mandate such disclosures, aiming to evaluate how medical journals address the AI integration in research through their author guidelines and policies. For our methods, we did a cross-sectional review on 100 peer-reviewed hematology journals ranked by the 2023 SAMAJO SJR indicator. Data was extracted from each journal's instructions for authors section to assess AI-related policies, including authorship rules, requirements for disclosing AI involvement, and guidance on using AI for manuscript preparation, data analysis, or image generation. Associations between AI-related policies and journal impact factors were also analyzed. Correlational analyses were performed using R-V4 2.1 and RStudio to explore relationships between the AI policies and the journal characteristics. So for our results, we can start with table one, which is just looking at our journal characteristics. The majority of these journals actually came from Europe and North America, and most of their impact factors were between 2 and 4.5 and an average of 2.6. Table two really offers the AI guidelines that we have. The characteristics included for these journals that AI tools for authorship was kind of split in half between yes and no's, but most of them were not stated and didn't have any policy regarding that. For the disclosure of AI during submission, it was between yes and not stated, with the majority 52 actually having a disclosures themselves. As we look in AI tools and the manuscript writing, most of them didn't have a policy regarding it. And the AI tools in content generation, most of them either didn't allow it or didn't have any policy regarding it. And the AI tools allowed in image generation were predominantly not stated and didn't have a policy. When we look at our figures below, I just included that any AI mentioned in the instruction for authors for any of these journals was split yes and no, with the majority 56 having some type of AI mention in those instructions. However, when we look at figure two, we look at the ICMJE reporting guidelines for AI, and the majority of these journals didn't have any reports regarding that. So when we look at our conclusion, although many hematology journals acknowledge the role of AI in research and endorse the ICMJE standards, a lack of standardization policies hinders the transparency and ethical implementations, especially when we look at the ICMJE AI-specific reporting guidelines and the lack thereof in these journals. To improve transparency, we recommend that the hematology journals adopt uniform AI-specific guidelines to promote ethical and transparent use. Establishing clear, uniform guidelines on AI use is crucial to ensure the ethical, reproducible, and high-quality research practices in hematology.